Hello, thank you for tuning in to Dr. Chan's Minor Ailments Forum again. So I would like to spend some time on talking about how type 2 diabetes presents and how we actually diagnose type 2 diabetes. It's just become a really hot topic really in England because diabetes has been creeping up and the numbers of new diagnoses have been going up as well. So I thought I'll take this opportunity to have a quick chat about that. So let's just talk about how people know or might feel that they've got type 2 diabetes. Some people are very health conscious and they might say, oh, I've got a family history of type 2 diabetes. I'm getting a bit older now, so maybe I'll go and see a doctor and have some blood tests done to see whether I could be diabetic. And that would be a screening process triggered by a patient. Then we do a blood test and to see whether they're actually diabetic or not. But most of the time, people actually present with symptoms. So the common symptoms would be, they would say, yeah, I've been feeling really tired recently and I sleep all the time. In fact, I'm watching TV, I'm falling asleep. It's not like me, I'm normally quite energetic and run about and do things, but I can't do that now. Or some people might say, well, I've been very, very thirsty for the past few weeks. It doesn't matter how much I drink, whatever I drink, I get very thirsty. And also I pee a lot as well. And when I go and pee, I've noticed some bubbles or froth in the urine. Well, that's not normal, is it? So that's the common presentation that they come in with. And obviously there are others. For example, some people might come in with really serious foot ulcers, and that obviously is a bad case when they do come in with infected ulcers. Then you diagnose diabetes. That probably might mean that diabetes has been going on for a long time or is actually quite poorly managed. But some people might actually come in with recurrent infections of the skin and they never heal or healing rate is really slow, etc. So when people presented with symptoms like that, we generally would advise them to provide urine sample. So number one things to check is, are there any sugar in the urine? Obviously, it's a primitive test. It wouldn't tell me if there's sugar in the urine, then it probably very likely that is diabetes. But no sugar doesn't mean that that's not diabetes. So that's the first step that we do, that easy test that we do. And the second stage, we would recommend some blood tests. Now, the tests have changed in the years gone by, but let's just talk about the fundamental test that we do first. So in patients that we're suspecting they have diabetes or family of history of diabetes, then we would advise them to do a fasting blood test, in particular fasting glucose. So generally speaking, if you're not diabetic and when you do a fasting blood test, the sugar wouldn't be more than 5.5 millimole per liter. So if you do that and the number is normal, then you can say, yep, probably unlikely to have diabetes. But it's also, you have to think about it with the symptoms as well. And if that's normal, but the patient has symptoms, you might need to look in further. So let's just say if the blood tests come back raised, you might want to do some extra blood test, which is a glucose tolerance test. So this is quite old school blood test that we do. So first of all, you would have to have a fasting blood sugar done, and then you go and drink some sugary drink that the hospital provide. And after drinking that, you hang around about 2 hours, and then we recheck the blood test again. So if let's just say your first blood test, which is the fasting one, is raised on 2 occasions, then you can say that this person probably have diabetes. But let's just say if the first fasting blood test was raised, but the second one that you repeat is normal, then this is why you would do a glucose tolerance test. And to confirm that the patient has diabetes, the 2 hours later blood test, i.e. you had the sugary drink, would be more than 11.1. So then you can say that this person got diabetes. Now, in the past 10-20 years, there's been a new term, it's called pre-diabetes. So it's mean that the people who are not really diabetic yet, but they might develop into diabetes because they have raised fasting blood sugar, but when you do the 2 hours test later, the test is normal. Now that means that these people, you need to pay attention to them, because they, in the next, don't know how many years, 5-10 years time, if they don't look into their diet or lifestyle, they might easily develop into diabetes, and obviously untreated there will be complications. So that the blood test that I just talked about, a glucose tolerance test, is what we normally do to 100% confirm, yes, whether you're diabetic or whether you're pre-diabetes. Now, there's been a new studies coming out and new guidelines coming out on how to diagnose diabetic patient with a blood test called HbA1c. Now, the people who are already diabetic, you might actually know about this blood test because you probably have it done every 3 to 6 months or every year. This is to check how well your blood sugar is controlled in the past 3 months time, okay? But this blood test is also used to diagnose new diabetic as well. And the cutoff line is if the blood test is raised, i.e. if it's more than 48, then it might indicate that the patient has diabetes. Now, obviously there's some flaw in it. Some people who are very well controlled diabetic, this number might be low as well. And people who are anemic and have HbA1c blood test done, this result will be inaccurate as well. So sometimes depends on the clinical presentation and depends on the person and the results. You might actually needing to do the glucose tolerance test and HbA1c anyway. But the bottom line is, if you have symptoms that might suggest diabetes, for example, tired all the time, you drink a lot and still feel really thirsty, you need to pass a lot of urine, or you might notice bubbles or froth in the urine, that might indicate that you are either at risk of developing diabetes or you might actually have diabetes. So I would strongly advise you to go and see your GP to have a discussion about having a blood test done. Okay, so I hope that the information is useful for you, and stay tuned. There'll be more information for you down the line of other minor ailments. Thank you. Bye-bye.